debate. And Russ, you are very right in saying that NHS Dentistry, despite what the Welsh government would have you believe, is in crisis. A crisis that started long before COVID hit our shores, but made it much worse by the pandemic, and the Welsh government changed to the contract of dental people. Last Thursday evening, I attended, along with Mike and Shannon, a special meeting with the Morganwell Local Dental Committee. Nearly 50 local dentists, practice managers, dental nurses, hygienists, therapists spent an evening explaining to us politicians why NHS dentistry was suffering in the Swansea Bay Health Board. I was truly shocked by the depth of feelings that they are being let down by Welsh government, but heartened by the absolute commitment of all those who attended to maintaining NHS dental provision. Dentists feel they are not being listened to, and there was concerns raised at the meeting about the suitability of advice being given to Welsh government. The fact that the chief dental officer had never worked in the NHS dental practice was cause of concern. In the minds of the dentists operating at the coalface, this has led to a dental contract totally unsuitable for dentists and worse for patients. As one dentist put it, the contract is bad for dentists but horrific for patients. It is a deformed contract, not a reformed one. Many practices have been forced to rely upon private patients in order to subsidize their NHS patients as the contract is capped. One practice told us that they have 13,000 patients but only received funding for half that number. The dental contract is driven by targets, preferring quantity over quality. This is forcing many dentists to abandon NHS contracts or retire altogether. Across my local health board, only 40% of dentists are now doing NHS work. With a large number of dentists set to retire over the next few years, this is set to get a lot worse. Only 38% of recruitment campaigns to replace the dentists have been successful. Swansea Bay has 16 training practices, and over the past 5 years, they have trained 70 foundation dentists, yet only 9 remain in the area. Cardiff School of Dentistry only trains 70 dental students and a handful of dental therapy students each year. Nowhere near enough to fully staff and practices to provide dental treatment to the Welsh public. But when you consider that a student can leave the dental school and go straight into private practice, doing cosmetic work without having to go through the additional years of foundational training, you can see why it is an attractive option, particularly when they can earn far more than they would on the NHS. Which is why our motion not only calls for reform of the dental contract, but also to refund tuition fees for those who work for 5 years in Welsh NHS dental practices. We have to incentivize people to pursue a career in NHS dental practice. The dentists who spoke to us last week are thoroughly committed to the NHS, and I would like to put on record my thanks to their dedication. Let's help them look after the nation's dental health by making the Welsh NHS the best place in the world to practice dental medicine. I urge colleagues to support this motion. Thank you very much.